Doctors, dentists and dermatologists of Reddit, what do you actually recommend and what is balls? Doctor here. Have an advanced directive. You don't want other people making your end of life decisions when you can't speak for yourself any longer. Take ownership of your own death and dictate the terms. The advanced directive is as important for your family members as it is for you. It takes the burden of making life or death decisions off of their shoulders. Family members struggle for the rest of their lives in some occasions, wondering whether or not they made the right decisions. Navigating the ICU hospitalization for a terminally ill patient with many comorbidities, endless procedures, scans, lab tests, medications, complications is hard, even for medical professionals. Try doing that with no medical background and the weight your family members' well-being thrown in. Heavy stuff. Family Med Doc here. Keep moving. Far too much acute pain becomes chronic pain due to simple deconditioning and demoralization. Added to that, FFS. Don't be as stupid as me and ignore pain for like a year such that it become impossible to treat. Acute pain is way easier to fix than chronic. As a doctor, one of the most common things I see, back pain needs to be treated with core strengthening exercises. Taking narcotics and staying in bed will make it worse. As a tall person with back pain almost gone away after 2 years of pull-ups and planks, this guy is 100% correct. Pediatrician here. Brush your toddler's teeth before bed and do not send them to bed with a bottle of juice or milk. Dental caries are the #1 reason for surgeries in young children. Toddlers generally require a full anesthetic for dental work. Don't be a dong and cause your child to undergo the risks and distress of a surgery because you can't brush their teeth. I have seen children require extraction filling of all of their teeth because of this. It is completely preventable. Also, vaccinate. I've noticed a disturbing attitude in young parents recently. Oh, those are just their baby teeth, so it doesn't matter if they rot out. I actually heard someone make that exact statement. I feel so bad for their children. You can brush your teeth too hard. Don't do it. You aren't helping yourself. Audiologist here. No one ever knows what we do until they need us. Wax vacs and other OTC wax removal vacuums do not work. They have very little suction to the point that they cannot lift the corner of a tissue. I have one in my office to demonstrate. Earwax is protective. It's supposed to stay in your ears to balance pH and to prevent dirt, foreign bodies from migrating in. It clears itself. Unless the doc says you have an accumulation problem that leads to total blockage. Don't touch it. If you do have blockage, the only recommended wax removal is a peroxide solution rinse. And this is only after we've confirmed you have no perforations in eardrums that the liquid could penetrate, which leads to infections. Noise cancelling headphones earbuds do not cause more hearing loss. Ill-fitting headphones do. The tighter the seal of the headphone bud, the less ambient noise you must overcome, and the lower you can play your music satisfactorily. Of course, some people will be idiots. Damage occurs with intensity and duration of listening, so your music should be at a level that you can have a conversation over without raising your voice. This is moot if you are wearing specifically noise cancelling headphones or buds, because you shouldn't be able to hear me well even with music off. I shouldn't be able to hear your music if your headphones fit well. All cures for tinnitus, like drops or pills, are snake oil. 90% of individuals with tinnitus also have some degree of hearing loss, and 70% of those with loss and tinnitus note relief with the use of hearing aids to treat the loss. If you have tinnitus, test your hearing and stop buying crap from magazines. Use a Sonicare. Costly at first, but regular and proper use will save thousands. Also floss, you plaque suckers. You're like a pirate dentist. I'm a gastroenterologist, so maybe a bit specific. Eat more fiber. Miralax is magic, but only if you take it with the recommended amount of fluid. If you eat a bunch of garbage, you will feel like garbage. Those places where you send in your stool to see the profile of bacteria in it aren't going to help you. Maybe in the future, but for now that information means nothing. Treat your liver well, if not for yourself, for someone else who may need it. We do living related donors for kids. Be an organ donor. Yes to vaccines. Adults and kids. Drink plenty of water. Keep your hands off your face. And wash your pillowcase regularly. This will help a ton with acne. For body acne, especially on your back and shoulders. Try to wash it in the shower as best you can and wash your bedsheets often. This sounds dumb, I know, but wear clean shirts. You could be allergic to something in your laundry detergent. In my experience as a doctor, these are my recommendations. Please do not smoke, exercise regularly, eat healthy, drink moderately, stay away from drugs that led to an addictive lifestyle. The majority of people I see on a daily basis fail to adhere to the above recommendations, and it reflects on their health. It's not when you are young that you see the damage of unhealthy behavior. It usually comes when you're 60 years and older. That's when the diabetes, COPD, angina, alcoholism, cancer and all the other bad stuff starts to really frick with your life. Take care of yourself now when you are young so I don't have to take care of you in the future. Internal medicine in practice 15 years. I regularly recommend exercise. Do anything that gets you to 60-80% max pulse for age. 220 ages max pulse, 30 minutes 3x a week. It lowers bad cholesterols, LDL, triglycerides, and raises good HDL cholesterol. It lowers blood pressure, decreases insulin resistance, very important in diabetes, improves depression scores better than most psych medications, and many other benefits that will never be found in a pill. Meditation, 15 minutes 3x per week. I primarily use the first exercise from meditation in minutes a day. I use this a lot with anxiety, PTSD and insomnia. I use it as adjunctive treatment for diverse problems. Vaccination. Even with a relatively less effective vaccination like influenza, there's no other better alternative. Tobacco cessation. Personally call them cancer fertilizer, but find scare tactics aren't really effective. Most helpful is educating people on urges, the role of emotion stress, self-defeating behaviors and ones that help increase success. Glycemic index diet. Helps whether you're pre-diabetic or diabetic at any stage. I've had people make dramatic changes in their blood sugar because of this. The Glycemic Index Cookbook, Idiot's Guide, I've used, which is a lot of good recipes. Anything shouldn't be my opinion but backed up by peer-reviewed evidence. Medication is a very broad topic, although I'd check out the medical letter if you want unbiased information regarding a particular drug or treatment. They've been around since 1950 and take no advertising. It's subscription, but you can look at samples. Really nice. Podiatrist foot doctor. Here, for the love of God, please don't keep trying to remove an ingrown nail yourself. If you don't get it the first time, you won't likely succeed the second, or third or fourth time. And also, be skeptical of overpriced custom orthotics. Some of those things are just worthless crap. Dental student here. Actually visit your dentist for checkups. Waiting until there is something wrong or you're in pain is often too late, and there usually isn't any pain associated with periodontal disease, which is what gives you those tombstone teeth, as I like to call it, receding gums and wobbly teeth. Gross. Go to the dentist every 6 months. As an oncologist, get the HPV vaccine. Men and women get HPV cancers. So I'm a paramedic and not a doctor, dentist or dermatologist, but take it from me. Put all of your sharp silverware into the dishwasher pointy side down. I have treated multiple patients who tripped on the door and fell right onto a knife and or a fork. One of them almost bled out then and there. It's one of those things that I think I never would have thought of until I ran those calls. Now I think about it every single time I'll load the dishwasher. Dentist here. I recommend actually picking up a toothbrush and using it regularly. The amount of people who don't do this but then ask about water picks and other nonsense astounds me. I'm an ear, nose and throat doctor and I can't cure your cold. If you come into my office with a 2-day history of runny nose, sore throat, and cough, you are going to leave disappointed because I'm just going to tell you to buy over-the-counter products. There is no prescription medicine that is going to shorten the duration of your cold. Now, if it has been going on for 7 days and your symptoms are not improving, we can talk about antibiotics. But if your strep test is negative, you still probably don't have to have them. I have taken antibiotics once in 10 years for pertussis, and I get sick 3-4 times a year. Brush your freaking teeth. Urologist here. Stay well hydrated please. Dehydration is the most common reason why people form kidney stones. Summer is coming and I'd prefer to not see you in the emergency room in the middle of the night while you're passing a stone. Drink water and juices. Favor citrus. Avoid dark colored liquids. Tea, soda. Drink to a volume such that your urine appears clear or light yellow. Low T is a mostly BS diagnosis aside from a few subsets of men. The normal range of testosterone is widely variable depending on your age. Frequently the symptoms of low T are really just the symptoms of growing old. Testosterone generally won't help you achieve an erection, rather just improve your arousal. Also, testosterone supplementation carries increased risk of cardiovascular mortality. For the older guys out there who are going to men's health clinics for help with your intimate life, make sure there is an MD overseeing your care. When they inappropriately dose your erectile dysfunction meds and you develop priapism, I'll have to put needles in your dong to drain it. Not a doctor, but I'm married to one. She's a pediatrician and one of her biggest things is to tell people not to give their kids so much juice. Parents think oh it's from fruit, it's healthy when really it's just chock full of sugar. Also, please vaccinate your children and get flu shots. As a medical professional in the emergency setting, stop taking Tylenol to try and kill yourself. If you are successful you'll destroy your liver and die a slow and annoying death. Please kids, don't destroy your liver with paracetamol or anything else in order to kill yourself. You will be in the worst agony for the next week. There is nothing to help you, and we need more people to donate livers. Doctor here. Take responsibility for your own health. Healthcare professionals are there to only offer advice. You can either take it and implement, or leave it. Don't expect us to work miracles if you aren't on board. Look after your health when you are young. Supermen living the fast life end up as scared and dying because of not taking care of themselves when they were young. Drink in moderation. Ditch the cigs. My biggest message is to calculate your BMI and do something about it if you are overweight. I see so many obese patients it is unreal. According to McKinsey, obesity costs the world more than total global armed conflict. If you are fat, you are at a risk of so many serious illnesses. It is unreal. If you are obese, even going for a simple operation where you need a general anesthetic puts you at major risk. Make up with your loved ones. Life is way too short to hold grudges, and that's not a cliche. Seeing people trying to do that with someone unconscious on a ventilator with little chance of waking up is heartbreaking. Pulmonary and critical care physician. Pulmonary advice. Don't start smoking. If you do smoke and are having a hard time quitting, talk to your PCP about nicotine replacement, or even medication to reduce cravings. My patients have had success with both bupropion and varenicline. Surrounding yourself with friends that smoke will make quitting harder. Try to get them involved or try getting them to join you in your effort to get rid of tobacco. If they refuse and continue to act as a roadblock to your success, get new friends that don't smoke. They will probably live longer anyway. For the kiddos, no matter what your hipster friend tells you, or what that homeless looking anti-government conspiracy theorist believes, or what Trees claims as fact, there are real pulmonary effects to smoking marijuana. If you ask the honest question of does inhaled cannabis smoke cause harm to the lung, the answer is yes. That said, if you ask me which is more harmful, marijuana, cigarettes, or alcohol, by far the latter two. Critical care advice. Have an advanced directive. Know that CPR isn't like CPR on TV. If you end up coding, it's unlikely that you will ever get back to your pre-code baseline. It's actually pretty unlikely that you'll be alive 1 year later. Think long and hard about the desire for mechanical ventilation. Do not work in a RIM lab. Psychologist here. Don't smoke weed to get rid of anxiety. It will not fix the problem and will actually make it worse over time. Vaccinations. People, get them. If you have an eye infection, vision loss, unexpected blurred vision, or literally anything else that concerns you with your eyes that is short of a nail poking through it, your vision going lights out, or other concerning systemic symptoms, please try to see an optometrist first. We are like your primary care doctor but for the eyes. If you have something that is truly advanced or needs specialized care, we will quarterback you to the appropriate specialist ophthalmologist. Otherwise we can care for and prescribe medications for almost any eye condition that doesn't require surgery at that very moment. In most states, Do go to an ER if you literally have a nail sticking out of your eye, or your vision goes black, or if visual symptoms present with other life-threatening symptoms. Most optometrists are trained to know how to diagnose all eye conditions, and with greater access to care that might be the difference in a better overall outcome. If you have something that requires you to an ER, we'll tell you. Not trying to start a turf war here or claim we are smarter than MDs by any means. Just trying to help you all save time, money, and your eyes. Keep a list of your medications, including the name of the med, the dose, and roughly the time of day you take it. Put this list in your wallet or smartphone. This will help you take things appropriately, and it will help prevent any serious adverse events if you see multiple doctors or ever get hospitalized. It will also make my job much easier when I first meet you, and more time can be spent talking about your medical problem, as opposed to figuring out which pills you are supposed to take. Also, just because one doctor enters your information in a computer in one office, it does not mean other offices or hospitals automatically have access to that. Hence the need to put said list in your wallet or smartphone. RN here. Anything that promises to detoxify you is rubbish. Your kidneys and liver do the job right nicely, and any effects that you feel typical are related to caffeine withdrawal or poor nutrient intake. You don't have a headache and feel fatigued because the toxins are leaving you. It's because you gave up your 4 Diet Coke a day habit and haven't had any protein for days. Avoid antibiotics if possible. Don't demand them when your doc tells you you don't need them. If you must take antibiotics, take a high quality, refrigerated probiotic while you're taking the antibiotic and for a week afterwards. This will help prevent the gastric side effects due to your gut flora dying off, and will also reduce the chances of yeast infection or C. diff infection. The less processed something is, the better it is for you. Eat less food, minimally processed when possible, and make the majority of your diet plant-based. Exercise every day, every freaking day. I don't care if you walk a lot at work. You need to do strength training. You need to get your heart rate up. You need to actually exercise. Don't smoke. Just don't. You have been visited by the typo dog. He will protect you from all typos in the next 24 hours. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.